Dementia is a very broad topic. In the next few minutes, I will go over a few things about dementia. It is a disease with many symptoms, and we do not yet know everything about it. Scientists continue to work very hard at finding a cure for it, but until then, let's learn some of the things we do know. What is dementia? According to Brandt, a decline of previously acquired intellectual or cognitive skills. He went on to say, dementia is not a disease but a syndrome that has many causes, including head injury, vitamin deficiency, hydrocephalus, epilepsy, depression, medication effects, and toxic exposure. Brandt also mentioned that it was often associated with behavioral and or psychiatric changes such as poor judgment, for example, dressing inappropriately or reckless spending, delusions, false beliefs, or hallucinations, seeing, hearing, or feeling things that aren't there. Are there different types of dementia? Brandt states that due to similarities in the clinical presentation of patients with disorders affecting primarily subcortical structures, which differs from that observed in dementia caused by cortical damage, the terms cortical dementia and subcortical dementia are often used. Rockwood also says, known as a syndrome, that is, it is a collection of symptoms and signs whose presence can be diagnosed, but the diagnosis does not in and of itself suggest a cause. For example, the syndrome of dementia has a number of causes, including Alzheimer's disease. How many types of dementia are there? A few different levels Brandt mentioned are pre-dementia, mild dementia, moderate dementia, and severe dementia. Rockwood also listed a few names and symptoms such as Alzheimer's disease, Lewy body dementia, and frontotemporal dementia. Is there a cure? Hardman says scientists are now trying to come up with medications, which they call plaque busters, that will actually help prevent the damage from the very beginning. He goes on, saying the hope is that these new kinds of medications might not only prevent damage to brain neurons, but will also stabilize the symptoms if they have already developed or even reverse symptoms. What kind of treatments are there? Brandt also made a few comments about treatments, such as neuropathological techniques and new drug treatments. How can doctors diagnose dementia? Brandt says that to be diagnosed with dementia, you have to have a memory impairment or at least one other cognitive domain. Hardman states scientists are working hard to find ways to diagnose dementia a lot sooner and more accurately so that the right course of treatment can be started. He continues, saying that researchers are trying to develop new and improved brain scanning techniques. A current problem with brain scanning is that many people have been misdiagnosed and have received drugs for the wrong disease, which in turn hospitalizes them. What does it have to do with Alzheimer's and caffeine? How about fish? Hardman believes that dementia is a symptom of Alzheimer's, and scientists think that maybe dementia can be prevented by caffeine. He also says that some research evidence suggests that omega-3 fatty acids, a subject found in fish oils, may help prevent Alzheimer's disease. What age group does it typically affect? Rockwood believes, although it is not often said, chronically generally applies to progressive, that is, it is usually the case that the dementia gets worse over time. While there are some dementias that can have prolonged periods of plateau, most dementias follow a characteristic pattern of decline. The pattern of deficits seen as the decline progresses forms the basis of staging the dementia. Rockwood continues with, the word chronic is meant to distinguish dementia from delirium. While delirium is another cause of global cognitive impairment in elderly people, it typically comes on acutely and resolves quickly. He finishes saying, dementia is a common problem among older people, affecting about 10% of the population over 60. Although dementia is age-related, it is distinct from the normal aging of the brain. Does it affect long-term or short-term memory? Brandt mentioned briefly that typically the memory loss is a long-term memory, although occasionally in more severe cases the subject will have trouble repeating numbers they heard just seconds before. Is it similar to delirium? Another thing Brant said was delirium is associated with memory loss, but it is also associated with disorientation, confusion, and alterations in consciousness that fluctuate throughout the day. Once again, this is a very broad topic, and there is plenty more to learn and discuss. Research and science will help us get there, hopefully sooner than later. Dementia is something we can always learn about and something that it can affect anyone's daily life.